Greetings, everyone. My name is Asatu, and I just wanted to thank everybody for coming to our GoFundMe page, which has the purpose of supporting and providing information on our journey and my warrior princess, my daughter, who has been diagnosed from birth with sickle cell anemia. It has been an incredible journey for my wife and I and her brothers. A journey of learning, a journey of patience, a journey of accepting, a journey of resisting, a journey of every possible emotion that you could think of, all rolled into one 8-year lifetime. And the purpose of these videos, there will be a lot of videos coming so that you can connect a face with the page and faces with the page. The pages, these videos will have the purpose of giving information and also hopefully to connect somebody or inspire somebody to continue to press on no matter what the chronic ailment may be. So I just wanted to first explain a couple of things about sickle cell anemia just in general so people can have an understanding of what it is that we deal with by having a child who has sickle cell anemia. In sickle cell anemia, you have the bone marrow, which manufactures the red blood cells. That bone marrow is receiving some information from the genome, from the DNA, that is telling it to make red blood cells that are sickled, have the shape of a sickle, almost like a crescent moon in some of the instances. Normal red blood cells are perfectly round, they're smooth as they flow through the system, they glide over one another smoothly. When you have sickled cells, many times they have jagged edges, points like a sickle. So those red blood cells will tend to get clumped together, and then you'll have certain situations happen which can tell you that your child or you or whoever might be carrying the sickle cell disease is beginning the stages of a crisis. Some of those symptoms may be pain, they may be inflammation. You can have jaundice because of the breaking down of the sickled cells. And this can happen in any place where blood flows, which is everywhere within the body. So it may be in a knee joint one time. You cannot count on it being in a knee joint. That next time it may be in the chest. It may be in the lungs. It may be in an elbow joint. It may be in the waist. It's a totally unpredictable genetic disorder. So you really have to be in tune with your child, in my case. And my wife is very, very excellent at that and knowing exactly and kind of reading the signs and being very proactive with that. There are a number of medications that come along with, having sickle cell anemia, both Western and homeopathic as well. We can get into that in a later video, but I do want to say that hydration is a major component of the disease, of making sure that crises don't happen. Hydration is a huge portion of the maintenance of the sickle cell anemia disease. Within the actual genome itself, I'll show you exactly where this abnormality is coming from. So what I have here is a picture of, it's called a karyotype. And it's basically your DNA. So you have 46 chromosomes in each cell. throughout your body. You get 23 from your mother and 23 from your father. So these are found within your cells. And there's a specific chromosome, chromosome number 11, which is this one. One from your mother, one from your father. There's a small portion at the top of chromosome 11. There's a little white region at the top of chromosome 11. And within that region, the bone marrow is programmed to produce a certain type of red blood cell that carries oxygen efficiently. Within that small region, the HBB gene is what it's called. In a sickle cell patient, this area is programming the bone marrow to produce sickled cells as well. So it is this region of the genome that is really so small yet so crucial for the bone marrow's production of red blood cells. You can Google human karyotype, Karyotype, and look at the very top portion of chromosome 11. And this is where the abnormality for somebody who has sickle cell is found. In other videos that we will be doing, we're going to share our journey, more of our emotion, the roadmap as we go forward for the cure, some of the medications that my daughter is taking, some of the ways that we manage the sickle cell as best as we can. And hopefully we can answer some questions for people who may be wondering about the disorder or anything concerning our journey. So once again, I want to thank each and every one of you for your time. My name is Isatu. Thank you for viewing our GoFundMe page, and please, please, please feel free to send the page around to as many people as you can possibly think of, because we will be needing a lot of support as we go for the cure, which can take up to 6 months in total before we can see true light at the end of the tunnel, and before we can say that we are well on our way to having the bone marrow transplant be viewed as a success in the near future. So thank you very much and take care. We'll see you soon.